this is a tradition that we've done for the last couple of years. Pull together a panel of a few of our billing companies and have a conversation about their business and talk about major trends going on in the market, things that they're top of mind, issues that they're struggling with. And that's really the purpose of today. So I'm going to start by quickly introducing the folks on the stage, and then we're going to do a little bit of background information on their companies, and then we're going to start the conversation. So let's see, you folks are a little out of order, so it's okay. You stay right where you are. I will improvise here. So first, on the end, we have Paul Ordonez. Is that how you say it? Okay, great, yes. Perfect. From Elite Medical Revenue Solutions. He's the CEO. And then we have our most famous billing company celebrity here on stage, Mr. Rick Kaufman, CEO of Billing Advantage. And next to him, we have Rhonda Shumway. She's the COO of ML Medical Billing. And last but not least, we have Dawn Lawler, and she's the owner of ABS Billing Solutions. So maybe in a really quick format, I'd love to have a few of you jump in and talk a little bit about what you've done sort of uniquely to go after new clients. Whether that's sourcing them locally, nationally. Do you do a particular specialty? Do you have some interesting way of getting their attention early on in the relationship that converts to business? So any kind of interesting insights or best practices that might be interesting to share for the rest of the audience would be great. Does anybody want to jump in?
We find trust is the most important piece. In our business, which is a family business for 30 years, what we have is an owner who actually has a brother who is an orthopedic surgeon in Beverly Hills, and I came from the practice side. So when they understand that we understand their business from their boots up, basically, I think that is a huge component to building trust. What I have found is you have to be a little careful about what you promise up front, because that is all they will hear is what you can do better for them. You must assess what they are not doing well so that you can drill down and fix those things too. It doesn't matter how good the billing service is if you cannot get the good data from the client quickly enough to get the money in fast enough. If you cannot get that from them, they will think it's your fault. So the first assessment of what's happening from the client side needs to be thorough and as honest as you can about it. And then you check to see if there's a cultural fit for your own organization and how you can deliver to that. I believe that that's what gets the trust more quickly. And you'd have to be a little careful because some of them will expect you to deliver at a much higher level than you may be able to in some occasions. So if they think that if they're asking you a question, you really don't know the answer, maybe don't tell them an answer because they think that you are the decision maker. Oftentimes they're the decision maker. They have the contracts. They've signed the contracts. You don't know what those are. So be a little bit careful about telling them what you can deliver at the beginning so that they don't expect that you're going to over-deliver from the start.
I just agree with it. It starts with customer service, and if you can provide great customer service from the beginning, then you're going to own that client. I never overpromise what I can't deliver or what my staff can't deliver. I'm pretty honest up front, and typically, if they're leaving another billing company, they're going to try to tell you it's not their fault, but usually it is their fault, and you're going to have the same issues. So never overpromise or promise anything you can't deliver.
Now, Dawn, when we were talking yesterday, you talked a little bit about the work you do on credentialing and how you parlay that into billing clients. How important is that to your growth strategy? What percentage of clients do you get from that, and how do you approach that?
I definitely think it is a big piece of my growth strategy. I never take on more than I can handle. 25 to 30 sounds like a pretty large number right now, but I do have a little bit of help now with the staff learning how to credential. I'm going to be looking into maybe outsourcing that because for a little while I said I wasn't going to take any more credentialing, put it on hold, but I took 5 of them last week alone. And I make them sign a year's billing contract. I will not credential for anybody who doesn't sign a year's billing contract. And I also try to sell them on the Kareo EHR right at that point too, because I believe it just makes our life easier. And we strictly use Kareo for all our billing. So the credentialing piece is a big component to the flow of our business. So we constantly have people that will be coming into billing, and it keeps us growing slow and steady, I guess, if that's what if you would call 5 clients a week slow and steady. I think it is now. But we we are getting a lot of phone calls, and they'll all come from word of mouth, but I will not take anybody for credentialing if they don't sign a billing contract.
Okay, great. Well, we met yesterday and had a little conversation on our own, and took some notes on some of the topics that seem to get a lot of energy from the group, and might be interesting to share with all of you. So we're gonna talk about some of these things in no particular order. One of the things that Rob talked about in his presentation is the role that billing companies can play in terms of adding value to their technology decisions, their technology deployment, supporting technology, which kind of brings us to the question of electronic health records and some of the regulatory programs, whether it's PQRS or MACRA or MIPS. And I think this group would be curious to know, what's your strategy relative to helping your clients adopt an EHR system and use it in their practice? Do you recommend EHRs? Do you help train the customer on the EHRs? Do you help them with some of the quality reporting or certification type reporting that they need in their practice? Or do you try to stay away from it? Do you try to stay really hands-off? So if any of you want to jump in, and we can have a conversation.
I found it very, very successful when I pitched Kareo. In fact, increased my rate of success on closing of the deal for the billing services. So all my practices, they had different EHRs as of the beginning of this year, and they all switched to Kareo as of right now. All of them, including neurologists who just...
I remember yesterday when we were talking,
Yeah.
You said, well, I just tell them they've got to use it. And the rest of the group here said, well, how do you do that? And so we were really curious, like,
Just straightforward. I mean,
just
you
your,
gotta use it.
your overwhelming charisma with the doctors? Just, what is it?
I was talking to these neurologists, actually my own doctor, and I saw that he's using Practice Fusion, and I said, how you like Practice Fusion? And I'm having problems. And how do you know about Practice Fusion? I said, well, I have a medical billing company. Oh, really? Is that a fact? I said, yeah. Well, I use the practice management, the billing module for my billing. I said, okay, well, let me take a look. So I took a look and see that he's at 85 days of payment velocity, 5 pages of rejections, 120 pages of unposted payments. I'm like, wow, it's a lot of work in here. It's like, really, what's wrong? I mean, you're missing a lot of money. Wow, can you help me with this? Yeah, absolutely. And I think you got to change the EHR. It's got to be integrated. That will definitely help you on your practice workflow. And he actually said, you're right. I want to switch. I actually was talking to Lorraine about this. So he's gonna give me his account and pass it over to Elite Medical, and
Great.
And I'm gonna give him all my services, and he's happy. It just happened on Monday.
Anybody else want to pipe in on this one?
I typically train my own accounts on the Kareo EHR, but I do lean on support from Kareo when I get frustrated training somebody that might not be as computer literate as I would like them to be. So then I'll usually call Sarah and ask for some help, and she's so wonderful, or have support help out a little bit, because they might need more than I can give them in the short amount of time. But I also help them customize their EHR for their practice, and right away they love the program.
Now, one of the things we were talking about as this topic came up yesterday is just, where your clients fall in terms of participating with some of these, Medicare programs, and do they go through all the work to the reporting to get, to sort of avoid the penalties, or they just take the penalties and sort of move on? You guys want to briefly touch on that, how you approach that?
Yeah, my cardiologist, she's big on Medicare. Usually that's for Medicare.
Yep.
So I did jump on the subject. She was not using it. They're getting on board now, and they find it very helpful through the EHR. That's one of the sales pitch in order for me to sell Kareo. Yep. So I emphasize on that. By the way, you can actually
So you're helping them with the program.
Yeah,
you're helping them comply.
They think I'm Kareo. So yeah.
Rhonda was going to speak. Yeah.
We take a little more conservative tact. We educate them. I loved the speaker last year. She's actually part of Kareo. They gave a magnificent explanation of how it works. The penalties haven't really hit yet, so we haven't seen panic over it. But when someone wants information, we educate them. We give them specific tools and or codes. We tell them they have to be in EHR really, and then we outsource to a couple places who will gather the data for them. We don't really want to take the risk for it not being done correctly, and most people don't want to pay what it would cost us to do it well for them. So we outsource once we've got them educated, and that seems to be working.
Okay. Let's keep going. Let's move on. So one of the other things we talked about yesterday was there was some intrigue around our Engage product and specifically the patient intake. So maybe from the panel, if there's anything you want to talk about relative to that, what you see the potential is, have you started to use it, how you think that might integrate into how you work with your clients?
The patient intake part is very appealing. We've had people inquire, and a couple of them start using it. I must admit I'm a little bit ignorant about some of the rest of the things Engage can do, and I'm looking forward to the workshop to learn more about it. That aspect of it, people are very interested in, and we've had some inquiries and some people starting it.
I think that, along with the credentialing, is what gets you to squeaky clean claims faster. You really want to turn your claims. We turn, I don't know what the actual number is. I need to learn more about analytics, but we're probably turning 75% of our claims around in 24 hours. If we didn't have to manually enter demographics or have the office enter them, when the patient's at the front desk and they were pre-entered, we could scrub, we could check eligibility more quickly. So we're really excited about Engage from that perspective. We've got a couple clients already using it. We're working through a little bit of there's a couple kinks. It's not perfect yet with the documents yet. So we're happy to see that too. And then the credentialing is also another piece where if you can't control what the client has done to get themselves set up to be able to even submit with their group or individual NPIs, it doesn't matter what you do with the claim. So I think both of those pieces with Engage would help.
Okay. Okay, moving along, we talked about a few other things. Last year there was a big focus in the keynote around patient collections and how, obviously the increased sort of share shift away from insurance to more patient responsibility and how you're managing that in the practice. We talked about, how you're going about just dealing with that in terms of, collecting against the patients, but also we talked about your business models. Do you charge for, do you carve out the patient, cash pay side of things in the practice or what you do? There was a lot of conversation around that, so do you want to maybe join in and?
Yeah, well, my personal experience in my contract is total dollars collected. That's what I do, standard. 6%, whatever it is, the rate that I want to charge, total collections. And I elaborate, it's whatever you take as patient collections and insurance collections. That's what I'm going to charge you, that's what I'm going to invoice you. This is clear. That's it. That's
Does anyone else on the panel carve out the cash pay in certain customer contracts?
No, we have the same arrangement that it's the percentage of the total amount collected from all the different sources. For us, I think the biggest thing that helps with patient collections is working with the practice and their front office and how they're managing it when people come in. One change that we made with one of our large customers that had their patient collections were terrible, and we actually worked with them so that in order to get to the waiting room, you now have to walk through the business office. And just that one change made a huge difference. But things like accepting credit cards, in some cases with some of the patients requiring credit card authorization up front, that you just automatically will charge the copay or deductible fee to the credit card each time. So that working with the practice to help them develop a more effective strategy.
Well, I'd like to thank you for getting Stripe on board. It's helped immensely. Anything that actually allows you to auto-post into unapplied means you're less loss of data. So that's been one, and merchant service rates has helped a lot. Keep beating them up on that. That really helps us to sell Stripe. Also, anything that's email that goes out gets opened more quickly, gets paid more quickly. The days of paper statements really are very dinosaur, archaic. As much as your clients think it's the best way to do something, you don't even know if it ever gets to your patient or to your guarantor. So all of those things going forward, an awareness, doctors and their staff need to be told that the patient balance is growing and growing. They don't really see the deductible portion. They don't understand that it's not being collected. They think it's magically collected by the billing companies. And for those people that want you to carve it out as a client, it still has to be posted. It still has to be collected. You still have to touch it. There's no magic that it just disappears. So I think educating your client and asking your front desk to please understand when there's a balance due, because it's much easier to, the machines, I guess, are outside. I think they're $49 if you go on a Stripe. So being able to swipe in the office and or anything that's done with email, any kind of click to pay now, pay here.
Is this something that you guys feel that you can actually mandate to your clients and say, hey, this is just the way we work? In coming on with us, you sign up for Stripe, we're going to send the statements this way, it's going to go electronic, it's going to go paper? Or is that a negotiation that you have with, on a client-by-client basis, how they want to handle that?
I think it has to be a negotiation. There are some, doctors' offices that have their procedure in place and they don't want to change it. So I wouldn't refuse a client based on that, but I certainly would recommend it.
Yeah.
Emphasize big on that.
I would too, just because of the HSA cards that are involved now. We try to push it on them, actually, because we think paper statements are no good either, especially with the younger generation. And so it's an easy convince, I think, once we hit the clientele with some certain details of why we think it will help increase their revenue.
All right, maybe switching gears here a little bit. We talked about analytics and reporting. Not just the Kareo Analytics product, which obviously I'm interested in hearing any experiences you have with that, but I'm more curious how you handle reporting overall. Obviously, as a billing company, a big part of how your doctors evaluate your performance are the reports that you share with them. So I'm curious, the approach that you take, do you give your clients direct access to the system to run their own reports? Do you put together a month-end reporting package that you email to them? Are you using any technologies to help with that? Are you doing things outside the system with your own sort of templates? I'd love to hear from the group how you approach that with your clients.
I do reportings on a monthly basis. I'm very anal about numbers. I'm a numbers guy, so I see payment velocity going, but one day I'm already worried. So I'm very, very thorough on that. And whenever I see my reportings, it's pages and pages, so they'll know where they stand. They understand what's rejections, or what denials, or what's on deductibles and everything. I'm very, very big on that. So I really like the reporting on Kareo, for sure.
Dawn?
We are using the Kareo Analytics. I have to say that I'm not well versed on it. My daughter is, and she sells it to our clients. So we give them a specific month-end report, and that's it. It's basic. Anything other than that, she sells them for a monthly fee on the analytics, and we charge them, and she sends out all the month-end reports that they require or are looking for and to generate to see, productivity within their business. She also uses the analytics to run the productivity on our business, on our employees. She can tell you who's working the hardest, who's not. So she's very well versed in the analytics, and it's also been another revenue stream for us.
Now, about you, Rhonda, you're one of the few billing companies with a dozen different systems, right? So the month-end reporting must be challenging. How do you approach that across your client base?
The way that we've evolved that for the past couple of years is we're very thankful for analytics, but we're really dependent on the key indicators. We realize in Kareo that the standard key indicator reports aren't as good. Some of the data is awkward. The beta is not so great yet, so we have to learn and we were listening to her about the analytics. Right now we have about 40 account managers. Each one of them runs their own month-end reports for each client. That is then sent to us in an email with any information related to that particular client that might show why receipts are up or down. If there's any particular escalation issue, the doctor was out for a month and that's why their charges are down, or things like that. But we have to hold our people accountable. Then those reports go out to each client with their invoice every month.
Got
So
it.
reports
So you
are
send it
critical.
physically.
Yep.
Okay. All right. We talked about a range of other topics, but I want to make sure that we leave time for Q&A from all of you. So we're going to transition to that. But just to give you a flavor of some of the other things we've talked about, we were talking a little bit about old AR. Do you take old AR? Do you not take old AR? That was a really lively conversation. We talked a little bit about how do you deal with billing your clients. There was some conversation around requiring clients to be on ACH and having authorizations on file so that you can automatically charge them each month. That was an interesting conversation. Another part of the conversation was around EOBs. As you probably all have the experience of your providers sitting on the EOBs so that you can't post them and so you can't bill them. And how do you deal with that? Obviously getting as many clients on ERAs as possible helps us solve that, but there's always going to be a certain portion of your insurance billing that goes paper and dealing with that. So we had a really good conversation, but at this point I'd love to open up to questions in the audience.
Hey, I have a question about, my name's Tim. I have a billing company in New York City and Sarasota. We're nationwide. We've been on Kareo since 2009. I have a question about your credentialing. You'd mentioned how you're doing credentialing and you're giving them a year contract. Have you ever had a dynamic where they credential everything and they don't move forward, so you don't ever make the revenue in the credentialing? And what do you deal with that? I usually bill it separately and give them like a discount on the back end to kind of force it to happen, but I was wondering what's happened with you in the past.
Unfortunately, I've never had anybody that hasn't come through yet, but I have thought about that, and I'm actually thinking of putting in my clause that there'll be another fee that would make it, a little bit more expensive, but I haven't run into that issue as of yet. I start billing them the minute I receive their paperwork, so I'll usually give them a monthly bill so that I'm already paid prior to them being finalized with their credentialing and have them sign their contract. So.
Yeah, I've been in the industry for 22 years, and that's been one of the bigger problems is how do you make sure you get paid for all those ancillary services? Because we're a billing company, but we're more of a practice management company, so we have all the services. But the problem is most people want to roll that into billing, and then sometimes the billing doesn't effectuate to any kind of valuable revenue to offset those costs. So it's always curious to hear how people combat those situations.
Yeah, hi, David Young with HTI Medical Billing. We're in Maryland. We're the medium-sized billing company. Question for the behavioral health panelists. We seem to be seeing a lot of denials on prior authorization, especially from state MCOs or Beacon Health. So do you offer prior authorization services? And if so, how do you go about doing that? Do you take care of do you link to their schedule, or if you can kind of speak about that?
Yeah, it's one of the large value-added processes that we have for our behavioral health and some other some other specialties that require prior authorizations. We do what we call for an increased percentage, we offer what we call benefit verification and authorization tracking. So when they get a new referral, they send the information over to us. We verify the benefits with the insurance company, and it's not just clicking the button in Kareo, because for the specialties that won't give you what you need. So we either call the insurance or we go to their website and get accurate, as much as we can, information. And what's the copay? Is there a deductible? Is this provider in network? Is an authorization required? We get all that. We send it back to them quickly within the same day, so they know before they see the patient, what all the benefits are. And then we track the authorizations and we let them know when there's 4 or fewer remaining, or if it's going to expire in a month. For some of the insurances, we can just get additional ones approved because they don't need clinical information. For some of them, you need clinical information, so we'll send the form to the practice and tell them they need to fill that out and send it in.
And then, Dawn, you had an interesting part of your business where you're actually taking the calls for some of the practices. You want to talk about that briefly?
Yeah, so we have a lot of psych MDs and nurse practitioners that work several different places and would come to us and tell us that they couldn't keep up with their private practice, the phone calls, this. So we actually give them a phone line and answer their phone. It's additional service, it's more fees. They'll get one person in the office. The same person will have a backup person for each company too, and they schedule their appointments, take refill calls, do the pre-screening of new patients, and there's a whole bunch of questions to ask. Obviously, in mental health, we don't want somebody that's, suicidal or, med seeking. So we have developed a whole list of questions to pre-screen the client before they get into the office. So we have several of those phones. It's not something we're advertising. That too is going word of mouth, but we're finding that it's spreading crazy. So it's been a great, and we up the percentage and we charge them for a line.
Okay, I think we have time for one more quick question. I think there was one in the back.
Hi, Sheldon Johnson with Bottom Line Consulting. We opened our doors in 2016. Have a question about, we're coming across a number of times now where originally our clients had very low capitation, and lately we've been getting some with a large percentage of the practice capitation. So I was curious, how do you price that?
A percentage still, I just require the EOBs and the payments, because you don't see that on an ERA. I need to see the actual payment. I required that from my provider, who actually is big on capitation. And it's a percentage regardless. That's how I invoice them, based on a percentage of what I collect.
So not the percentage of the patient population, but from the EOB?
From the EOB, right,
okay.
Of what's collected.
Yep.
So you need that information.
Yep. Okay, I think we're out of time. So I just wanted to finish by thanking our panelists for taking the time yesterday and obviously today to share the insights. And maybe we could end with just a short round of applause.